Well, let's see. I'm a citizen. I pay her tax dollars. I'm really unhappy with a lot of the policies she's pushing. She believes in this climate change issue as something that gets serious that requires intervention. I don't agree with that. She is part. I'm seeing a lot of people who are trying to push.
It's a true fact because the hottest temperatures in the United States have been in the 1930s. Did you? Well, did you know that in 1930s?
Please don't belittle him. He's an adult, and we're trying to have an adult conversation, and you don't seem to want to have one.
Listen, man.
So she insulted him. I just want you to have that. Yes, you did.
Well, let me educate you. Since 1945, CO2 is admitted and started. Are you gonna let me talk?
So here's the other thing. I'm also here to.
Since 1945. Okay. Since 1945, CO2 emissions started in the United States. That was when we had the coldest temperatures for 30 years.
Okay, so he's provided an argument. A couple other things. I don't support this single payer push. It's destructive. I've talked to people from single payer countries. It's a bad program.
So what are people supposed to do?
That's a great question. The answer is we actually have to remove all these ridiculous regulations that make it harder for doctors to practice medicine, which make it harder for patients to get health care. We didn't have a good system. We had a quasi system at best. Insurance companies have been getting bailouts they shouldn't. I should be able to work directly with a health practitioner. I think that we should treat insurance more like car insurance. It should only cover catastrophic illnesses, but for routine maintenance, you pay for that yourself. If we allow for more choice and competition, prices go down. But if you have cancer, you should be covered. We should allow individuals to pull risk. Right now, you can't do that. Right now, individual doctors can't form co-ops. You either have to work in a hospital or be in private practice. Also, why does a doctor have to get a license in every single state? The human body doesn't change whether you're in Rhode Island, Montana, or Nevada. There's lots of reforms that we should consider. But single payer will make it harder to get health care. It'll make it more expensive. Please do. Let me